Are we live yet?
It's loading, just a second. And we are live. Yes.
Okay, all right. So, hello everyone. A warm welcome to the third session of Doctors for a Cause Roundtable. I am Shreya and I'm going to be your host for the evening. Let me first start by introducing our panelists for today. We have with us Dr. Gul from AMSA, Shivani from Clinicase, Dr. Roop from the Global Surge Network, Dr. Molly from MSAI, and Monisha from SIMSA. So without much further ado, I'd like to introduce our topic for today. So is it time to flatten the curve for online-based support groups for the modern day patient? Quite a controversial topic, I'd say, because over the last 1.5 years, I'm sure many of us have seen instances of pre-existing mental health conditions being exacerbated by the COVID-19 pandemic. And while social media was one way of staying in touch with our loved ones and the world in general, while we were all isolated, the same social media also allowed many organizations, even individuals, to come up with many measures and initiatives for group therapy sessions, online support groups, etc., etc. So while social media unarguably has had a huge contribution in turning this don't ask, don't tell approach to mental health into a do ask, do tell, let's talk approach, one question has struck me several times, and I'm sure many of us, you would also relate, that how effective are these online group sessions and what kind of an impact they have on its participants, on its members, who really keeps a check on them, right? So that is one question that I hope gets answered by the end of today's discussion. So before we start with the questions, I would like to put our case scenario for today on the floor. So our case is we have our 21-year-old Riza, who was recently diagnosed with anorexia nervosa. So over the past 1 year, she has been feeling terrified of stepping out of her house because she feels anyone who looks at her is going to think she's fat, and she's been losing touch with her friend circle. And so one day, while browsing through her socials, she comes across this Anorexia Nervosa peer support group with hundreds of people who are battling the same problem. So Riza ends up joining this group, and that turns out to be quite life-changing for her. And whether that's in a good way or bad way, I'll leave that for you to decide, because now she spends around 10-12 hours on her computer interacting with her friends from the support group. And on the bright side, though she does not look at her disorder in a bad light anymore, she feels more confident. She also does not feel the need to interact with her old friends or go out, because she thinks that anyone who has not struggled with the same problem as she has will not understand her. So keeping this scenario in mind, I would like to present my first question to Dr. Gul. So, Gul, do you think that online-based support groups could be an adequate substitute for in-person therapy?
Right. So I think the first thing would be to just kind of acknowledge that online support groups have really, come up in these past times, and they have been a boon to a lot of patients during the pandemic. So earlier, I feel like support groups were kind of limited to those people who wanted to find peer groups across the country, or those people who were unable or disabled to leave their houses. But in these pandemic times, of course, every one of us has been, confined to our houses, and they have played an important role in helping people continue important therapy, important discussions which are needed for everyday functioning. So and when done right, these groups can be helpful and impactful. In fact, there have been a few literature review studies which show that online cognitive behavior therapy are just as effective in treating mild to moderate depression. So that is kind of where I want to stress that it is these groups, when done right, stressing on when done right, because it is very hard to regulate these. People without proper qualifications have been starting them. There is not a lot of regulation on the number patient physician ratio. There's a lot of things which need to be looked upon, but if done right, these can help provide for support for mild psychiatric disorders. But if we go into moderate to severe psychiatric disorders, I feel like there is no you know, in-person therapy, as well as the proper attention of a doctor who can observe your body language, who can observe a lot of things which may be missed during online reviews, can not compare to the real thing. So online group therapy, while good for moderate and mild cases, is not something that I would recommend for very severe or even more big, severe psychiatric illnesses. So.
Thank you, Gul. I think that was a very important point. The severity of the mental illness or disorder, that plays an important role in our choice of the form of therapy that we choose. Right. So, Shivani, what is your take on this?
Yes. Hello. Am I audible?
Yes, you're audible.
I completely agree with Gul. And yes, definitely online support groups. Yes, it's a very great step towards supporting our peers and coming across people who are facing those same problems, because then the struggles become a little easier, right? When you come across people who and see them that even they are going through the same thing, same difficulties. So it's a collective effect. You feel that you have someone who can understand you. But when it comes to severe disorders, I definitely agree that online support groups will lack the moderation, the coordination, the follow-up. And also one more thing I would like to emphasize, Gul has already mentioned it, that body language. Sometimes even when we are talking, we are so much into what our thoughts are about, and whether we are making sense or no. But our body language never lies. That is noticing a person's body language can reveal a lot of things about the person, how the person is, and a lot of subtle factors which even the person doesn't know, but the expert will definitely know what kind of help this person needs, what kind of what he's feeling. So to get in terms with your own thoughts is one thing, and the body language could definitely reveal so many factors that even that person won't be aware about. So in online support groups, I don't think so that can be achieved. And the expert on board or the psychiatrist on board it will be very difficult for that person to judge whether whether the person that I'm talking to is spilling all the facts or no, or maybe they are hiding it. Maybe they are just sugarcoating their issues, because when we're talking about our own issues, we tend to sugarcoat it. We don't reveal everything. No one will sit and no one will just start from the start till the end, reveal everything to you. So there are many aspects and many factors in which the experts have to dig around the topic and take many other factors into consideration, how the person is reacting to a certain question, to a certain situation. So definitely online support groups, yes, during the pandemic, it was a big hit, huge hit, and everyone needed support. But personal therapy should be definitely preferred. And online, therapies can sometimes act as a substitution, but I don't think so it's going to replace personal therapy, because the results and the conclusion will be completely different in both the therapies. And as mentioned by Gul, that the severe disorders, definitely personal therapy and one-on-one interaction with the person should be followed and should be done.
All right. Yes, I must agree with you that body language does play a very important role in assessing the condition of a person who's struggling with mental health, especially someone who is struggling from a mental disorder, for a psychiatrist or a psychologist. Right. So, Dr. Roop, what do you have to say about it?
Good evening, everyone, and welcome to our viewers. Firstly, I would like to thank the organizers for putting together a great panel. And the topic today is also very interesting, so I can't wait to get into discussion. Now, coming to the question at hand. See, I'll tell you, I'll discuss somebody who will not benefit from online group therapy. Anybody who is suffering from an acute health crisis, somebody who is in severe depression, suffers from severe anxiety, severe PTSD, any of the severe mental disorders, or somebody who is actively suicidal, that is the group of people that will not benefit in an online support group. So for this group of people, online support groups can be an effective therapeutic adjunct to the offline therapy. You can complement offline therapy with online therapy and online support groups. But for these set of people, it cannot be your primary care that you are giving them. You will not do justice to those people. The kind of service that they need, you will be unable to provide, no matter how much effort and how much time you give in. They need one-on-one sessions or in-person sessions. Now coming to the people who can for whom it will be an adequate substitute. So now, like here, we are discussing somebody who is suffering from anorexia nervosa. So these people suffer from body dysmorphia. They do not like to step out of their house. They tend to socially isolate. They are insecure about the way that they look, their body image, their weight. They might not want to go out. So for them, it is a good alternative. You will be sitting in the comfort of your own home. You can schedule your own time. It can be incorporated in your schedule, your daily activities. You can check in. And you can also ease into socializing. Let's say it is a discussion or it's a support group that takes place on Zoom. They have an option to turn off their video and still interact or not interact, right? They can ease into it with their own pace, which is something that somebody with anorexia nervosa would want, right? They can express themselves freely. It will become a safe space. It will be confidential. There will be facilitators and supporters and sponsors who will tell them, they will give them their tips and what is needed, what is not. And it will be a place where they can discuss eventually what led to their downfall, what led them to be diagnosed with anorexia nervosa, their relapses, their recovery, all of it. But obviously, I do believe that there must be a balance. You cannot be on the screen in a support group, isolating yourself from the rest of the world, because then you just jump from one problem to the other. First, you were isolating from everybody outside because you were anorexic. And now you're isolating from all your other friends because you're only talking to your support group. So there must be a balance. And in conclusion, I would say that it depends on the person's own needs. It may be an adequate substitute, it might not. So it is situation specific.
Right, that is a very interesting insight that you've brought up. That is the tendency to self-isolate, especially in a person who's already suffering from one disorder, and the access to a lot of people online, it might even worsen their tendency to dissociate from the offline world completely. Right, totally. So, Dr. Molly, what would you like to say about it?
Hello, everyone. Thank you so much, firstly, for having this panel discussion. And thank you to all the panelists who put forth their opinions. With respect to this particular question, firstly, I feel that calling this a substitute might not be the best word, because, see, everybody identifies their safe space in a very different manner. I completely resonate with everybody's opinions on how important in-person therapy is and how effective that proves to be. But again, at the same time, there are many factors which people can access through not just online support groups, but other ways of online therapy as well. Putting up a very simple example, there are people, there are houses where maybe somebody would want to go for therapy, but their parents are not in support or don't identify with taking therapy or identify with counseling sessions. There's no concept like a counseling session for many parents, which I've also come across. And in these situations, maybe that online support group would be a good outlet for them to to relate with people who have gone through the same experiences, to identify their safe space, and to help with their situation. Ultimately, it's extremely nice of people to identify what can help them the most, because most of the times that's the first step of a problem. Many people are not able to identify that they need help. So here itself, by identifying that, okay, there's an online support group which can help me, that's the first step which they are overcoming, which is beautiful in itself. And secondly, now, when we talk about in-person therapy, a lot of times, let's say, very minor factors, let's say transport, let's say going from here and there, let's say even the cost part of it, we all know that therapy sessions are not always the most feasible financially, and especially when it comes to in-person therapy, that factor is like plays a very, very important role for anybody who's seeking therapy. So through online support groups, even that factor nullifies, right? Because not everybody would be able to afford, and that shouldn't be a factor for them to seek help. um I completely agree with Dr. Roop, when she mentioned that it's very situation specific and subjective, because some people might not benefit the most from in-person therapy. They might feel socially awkward, not very comfortable in a setting with an unknown person, but would be comfortable through a screen with similar people on the screen. And again, it can take a positive or a negative result, considering, let's say in this case, let's say, when we look at Risa through the anorexia nervosa case, here we understand that she did stop socializing with her old friends, but I mean, at the end of the day, she needs to identify a group where she is happy and comfortable with interacting. If she's not feeling comfortable with old friends, and this also brings in a lot of subjectivity, because either offline online, ultimately you will look for people who you are comfortable with. That can be irrespective, wherever you find these people. And online support groups can prove as a very beneficial way to do the same. I again completely agree that with severity of the situation, let's say a case of severe depression, online support groups might not be the first option. But again, the severity is a stepwise process, right? It starts from mild, moderate, and then many cases, there's a wide area of cases which we come across when we talk about depression. So again, not diluting or undermining in-person therapy, but I feel like it's extremely subjective for people to to perceive or to understand even online support groups as an outlet which can help them. And per se, I mean, we can't really compare both of them, because they can prove helpful to many people in different ways. So thank you so much. That was from my end for this question.
Thank you, Dr. Molly. One of the things that you said that really struck a chord with me is stigma. And I guess one of the saddest reasons why online support groups have recently gained so much popularity is that people are scared of the stigma associated with actually physically going to therapy. And, people finding out that I'm going to a psychiatrist, a psychologist, what will people say? I have to face people there, to face people in the clinics. And in fact, from my own experience, I have seen people who never even gave mental health a second thought, never even considered it to be anything. Even those kind of people have come up with, with struggles, with problems, issues regarding their mental health during the COVID-19 pandemic. So even those people who never believed in the concept of mental health, they went forward because they got the access to so many online support groups. So I think that is one merit that we cannot ignore. All right. Shivani has a question. So I think I'll go with Monisha first, and then we'll come to you. Right, Monisha. So what is your take on online-based support groups as a substitute for in-person therapy?
Yeah. Firstly, thank you so much for having me on the platform, and a great discussion and a much needed discussion is happening right here. And since I'm the last, I know that the amazing panelists here have covered most of what I had in mind. But there are some things that I would like to talk from as a mental health advocate point of view, and what I heard from others. So what I know as of now is that online support groups are a great platform to feel connected and felt by people who are facing the same issues that you have been facing, or you are getting pushed down because of. So for a person who is affected and feels lonely because of what they're going through, this feeling of connect and understanding from someone who has been through the same is something that can create wonders. And this can be an extremely positive thing, but how far can it help a person improve is something that's going to be dependent on a lot of other factors, like the constitution of the support group and the people involved in the particular group that they are in, and definitely the host or the psychiatrist of that group, who will become the key influencer. And whether they transit for the better or not is going to be dependent on all of these factors together. So what I would like to discuss is about how the members of the group can play a role in influencing the improvement and how advantageous or disadvantageous it can be. So motivation and help from the other person who is in the support group is extremely important, and the person who's getting into the support group is looking for mainly that, right? But in many occasions there have been complaints that the source that they are getting the motivation from may not seem authentic because of the online platform or the computer that behind which they are hiding, or behind which they're present. So these are some of the disadvantages that they face when they're sitting in front of a computer and attending an online support group instead of an in-person therapy. And especially when it comes to a mentally ill person who is sort of vulnerable at that position, trust is not something that comes completely easily. But once again, on the brighter side, if you are a person, if the person is a mentally ill person who is just wanting to feel connection towards someone, or in this world where competitions and races are completely pushing everybody forward, and people don't have time to look back and inquire about your health. When a person is feeling lonely because of that sort of survival in this world, finding someone who has been through the same things and who understands you is something that is probably going to be for some people the last string that is holding them together, and can definitely help them improve for the better also. But apart from this, how is in-person therapy and how well can in-person therapy help? Once again, in-person therapy also has its own advantages and disadvantages, and until and unless you connect with the right kind of psychiatrist or therapist, you won't know that either. So I know situations where the person does not feel encouraged or motivated, rather than they feel pressurized or demotivated or dejected at the end of the session. That sort of atmosphere is also there, whereas some people find extreme motivation and extreme push towards their life, and therapy has helped them improvise a lot and move them forward in life and given them the clarity that they want. That kind of scenarios are also there. So at the end of my discussion, what I would like to put across is both have their own sorts of advantages as well as disadvantages, and the person looking for an online support group is going to have to do a lot of research and understand what they're getting into, and feel do what they feel is right. And in this case of anorexia nervosa, I think what she did was right, because in the end she found something that she can relate to and something that she can connect to, which is pushing her life for the better. And that is what I would like to say for my time for this question. Thank you very much.
Thank you. That was very insightful and elaborate. I think Monisha really beautifully laid down all the pros and cons of group therapy for us. So Shivani, you have a question, then we'll come to you, Dr. Roop.
I don't have a question, per se, but yes, I would like to put a spotlight and I would like to highlight this thing which Shreya brought up, the stigma. And it is so deep rooted in our culture and in our community, and how even our parents, if you take them in an example, if you tell them that I don't feel good, I need therapy, they'll be like, what, you need therapy, what do you are you they'll think we are mental, they think we are crazy, going to a psychiatrist, going to a psychologist, you are crazy, you don't need therapy, just like the concept of sweeping all our troubles under the rug and just forgetting about it, just avoiding them. And it's really glad and I'm really proud to see that our generation here, what we're doing today is a proud moment. It's really, we should reel this in and we should be proud of ourselves that today we're talking about such an important topic, because our parents of parents, there's a whole lineage of trauma and lineage of all sorts of-
Generational trauma.
Yes, yes. And I don't understand the basic thing. Like, why can't they understand this basic concept of going to therapy is just like talking it out, coming in terms with your own faults, your own flaws, your own trauma. I am pretty sure everyone is aware that either your mom or your father or your grandparents, they, usually in the evening, they sit with their friends in your societies or in your communities and they're just talking. So if they can do that, then even if in a way, if you see, I'm not comparing it, but if in a way you see online support groups, it's the same thing. You are sitting with like-minded people who are facing the same problems, and you're discussing it, you're talking it out, and you are getting support. So that is the exact same thing which along with someone professional on board, facilitator or key influencer, the same thing is happening. So they are okay. Like our parents, the grandparents are okay with sitting during the evening time. They'll sit for hours and 2 hours. They'll sit and they'll talk with their friends. But if we tell them that you're doing the same thing, but it's called therapy, then they'll be like, no, are you crazy? Are you mad? I don't think so. You need therapy. You need to study more. You need to focus on your academics. You need to focus on other things. This is life. And this one concept that has been taught to us is I'm switching my to Hindi language, and they say that roti, kapda, makan. These are the three main priorities that a person should think about. That's it. You have food, you on table, you have a house to live, and you are wearing good clothes. Your life is thought. You are the richest person on the world. But they don't know that there are so many other aspects. Your mental health, how you're feeling, we are human beings. God has given us this, this quality of feeling stuff. But what to do with all of these feelings, what to do and how to cope up with it, that obviously God will not tell you that. We need to figure it out. And these online support groups and therapy helps us to do that. Many people are not that confident. It's not about confidence also. I feel it's all about, they struggle with their own feelings. They struggle with, why am I feeling like this? Why am I not normal? My other friends, my peers are doing better than me. Why am I not doing better? So, there are so many aspects, and I think so therapy helps with all of those things. And it's great that we are promoting this main topic. We're having this discussion. So I really would like to, thanks Doctors for a Cause for coming up with this topic, the much needed topic. So thank you so much. And we need to break this stigma, starting from our generation, and to influence our parents and everyone around us, that it's okay to go for a therapy or online support. That's it.
I think the thing with stigma hit too close to home for Shivani, and that is something I really relate to on a personal level. Okay, Dr. Roop, would you like to add something?
Thank you, Shivani, for a very detailed answer. I think stigma is the number one problem that every household and every child of our generation is facing. I would quickly like to touch base with something that Dr. Molly Mehta said. about isolation. So in this case that we have been presented, Risa is isolating from her family or friends. Now that I feel that that might not be the worst thing. If she is in an environment that has caused her to have a mental condition, suffer from body dysmorphia, her environment, her family, her friends might be the agents of cause. They might be the causative agents, or they might have aided in putting her there, right? So isolating or taking a break from them might not necessarily be the worst thing. Maybe she does need a new environment where people understand her, where she is coming from, and a healthy environment which will help her get better. So isolating might not be the worst thing. You do need a break from the toxic environment that you have been caught up in. See, the aim of any support group, be it online or offline, is to empower the person, to help them realize that they are not defined by their diagnosis. There is more to them, right? So any support group, I feel whatever suits them should be totally fine.
Thank you, Dr. Roop. That was a very important point indeed, that we cannot always generalize what everyone needs and what everyone is going to benefit from. So individual needs, individual preferences also matter. Right. So I think through our first question, we more or less discussed the merits and the detriments of online versus in-person group therapy. So moving on to our next question, we are going to explore another criterion that we often consider before choosing a type of a form of therapy for ourselves or someone who seeks our advice. So does the composition and exclusion criteria of a support group impact the personality and social habits of its members, or the benefits that they can acquire from it? And from the composition, I mean whether it's a heterogeneous group with people from different diagnostic backgrounds, or a homogeneous group with all people with similar battles, like Riza in our case has joined. Right. So let's start with Gul.
Right. So I think this is such an interesting topic to bring up regarding the exclusion criteria and, the composition of the group, because it is something that we don't immediately think of when we think of therapy, even in offline modes or in online modes. So I think that the composition and who you choose to include and not include plays such an important role in group dynamics. In person, like in one person therapy, I don't think it matters obviously that much, but in an online group therapy, it can play such an important role. It can play an important role in the person who is choosing to impart that therapy, and what kind of a number ratio they choose to have, what kind of, like you mentioned, homogeneous or a heterogeneous group that they choose to have, because a heterogeneous group cannot dive into a lot of specifics that a homogeneous group can. But at the same time, a homogeneous group may be a little bit of a trigger for some people who may not be very comfortable listening to certain things related to their own diagnosis from other people, or it may lead them down a further spiral. So it is very important to choose what kind of a group that fits right for every person differently. And second of all, even the dynamics of interaction between people in the group, not just with the person who is imparting therapy, even in offline modes, it plays such an important role. Like I'm pretty sure we have seen in a lot of movies and TV shows that where they show de-addiction, like Alcoholic Anonymous support groups like that, they have such a close relationship with other people. They take on a mentor-mentee relationship, and they do a lot. So that can help a lot of people regarding a lot of social disorders like alcohol abuse, substance abuse, things like that. But at the same time, a lot of groups may also choose not to allow their participants to mingle a lot with each other, just to protect everybody's privacy and things like that. So I think it is very, very important to choose every certain criteria based on what you feel like you need. And also there should be something of a provision where people who are imparting these support groups, they kind of come up with a criteria, or they come up with cutoffs which they feel will decide who is suitable for this group and who is not. Yeah.
Thank you, Dr. Gul. I think that was a very important point, and this is something that you're right that we don't always consider before going for a therapy form, any kind of structure. Right. So, Shivani.
Yes, I definitely agree that some basic criteria should be there and should be taken into consideration when you are even for the online support groups, to select and to see which people can join their support groups, and even for the person who is going and seeking out help, because this is a long time commitment, right? Long time investment as well. It's not, therapy is not just overnight it will be changed. There are a number of sessions, there are a number of meetings, and slowly and steadily you go about it. So to select a very specific and a very perfect group that will help you and that will help you achieve what you want is really important. If you're not happy with the online support group, it's not going to help in any sort of way, in any which way. Plus, the second most important thing is assessment, to be in check with where you are, where do you stand right now? Have you progressed? What is your growth? Do you still feel stuck in a loop, or are you actually going forward? Are you actually making change? Like, it's changing you, it's helping you. So this assessment also is really important, and if a certain criteria is there, the assessment becomes very easy for the facilitator and the key influencer as well. If it's a mixed group or a heterogeneous group, it becomes really difficult to keep a check on the assessment of each and every person's journey. But yes, in a homogeneous group, it can definitely help. So I would like to just add that. Thank you.
Thank you, Shivani. Dr. Roop, what is your take on this?
I feel while forming a support group, the most important step is a screening process. You have to decide what the goal of your organization is. What are your objectives? And what are the kind of services that you want to provide? Also, to which group of society that you want to provide these services to. On the basis of this, you form your exclusion or your inclusion criteria. It is important for the organizers to have this base. So you must exclude those people who are not, whose goals or personalities are not in alignment with what your organization stands for, or whose services, or to whom you cannot do justice. Somebody who needs 10 hours of services and you are only providing one. So you would not want that person in your group. It's not fair to the other person, right? Include only those people who have attributes that fit into your group. And you must pay attention to factors such as age, gender, race, ethnicity, the type of disorder or disease that they have, the severity of the disease and the disorder they have, right? And of course, their personalities. Having a strong and a very strict exclusion or the inclusion criteria will enable you to have a solid common foundation of your support group, right? Now, there are now coming to the personality and the social habits. When you are in a online support groups, there are 4 to 5 stages that a group goes through. First is the forming stage, or the stage of dependency, where everybody sort of opens up. They let their guard down. Slowly, they start talking to each other and they start having discussions. Second is the stage of conflict, or the storming stage, as they say. So this is the stage where you really put forth your opinions, how you feel about your situation or somebody else's situations. This is the place where there is a possibility of overt or covert conflict to occur. So unless you have a homogeneous group, your conflicts will increase and your healthy discussions will decrease, which is not the aim of your group, right? And then there are 3 factors which play a role, three forces, three factors that play a role in the working of your group. First will be your individual dynamics. Second will be your interpersonal dynamics. And third will be the dynamic of your whole group. Right? So all these three things must work perfectly in order for you to provide optimum care and services to the group members. The members come to you in a vulnerable state, right? Somebody who is coming to you obviously suffers from a problem. They are looking for help. They are looking for guidance. They are looking for ways to cope. Or sometimes they're just looking for ways to accept what diagnosis they have, right? So it is important to have positive influences only. You cannot drag them down, right? So it is important to have positive influences on their personalities and social habits. And for this very purpose, it is important to have a homogeneous group. Somebody who understands what they are going through and somebody with whom conflict will be minimum and will aid in their recovery. It will help them get better.
Thank you, Dr. Roop. Conflict of interest, something that we have to keep in our minds while choosing the kind of participants we are taking in our group therapy session. That is a very important point, right? So, Dr. Molly, would you like to add something?
Hi, thank you so much. For this particular question, I feel that whenever a person is going or approaching an online support group, the first thing we look for is comfort. So that comfort can come through a homogeneous group or a heterogeneous group, and I think the composition and the exclusion is like depends from case to case basis. Now, for example, I'm I'm looking like if there's a support group working on depression, let's say, a person I would like to I would like to come across with people who have had who have had, let's say, similar experiences, maybe, which will help me relate with them. And let's say I'm looking for a support group which is which is working on let's say uh, let's say you know be like, let's say, on for introverts, who's basically helping them to come out of their shell, to help them get in to help them get out in the world, get out into the world more. And in that case, I would want to have people in that group who are already maybe not extremely extroverts, but something not similar to me, so that I can learn from them. I mean, this is my personal take on this. And also, I feel like that once you find that comfort in whatever form suits you or helps you, the next thing is that you would form some conclusions on the basis of the discussions, and these conclusions will heavily depend on the composition and the exclusion criteria. And only on the basis of these conclusions you will further incorporate changes which you were looking for to through this online support group. So I think it's it's a cycle of comfort, conclusion, and incorporation. And these three steps mainly, I mean, for these three steps to go in sync and to help you in an impactful manner, the composition and the exclusion helps heavily and is extremely important. I'll give a very simple example. For example, this particular panel discussion makes me feel stronger about women empowerment. So that is because of the composition of this group, right? And very similarly, that goes for any online support group. So thank you so much. I think this was what I wanted to say for this particular question. Thank you.
Thank you, Dr. Molly. I think that is something that we all realized in the beginning of the session. Yeah, so yeah, feeling proud. Okay, so next up we have Monisha from SEMSA.
Yeah.
So I would like to agree, first of all, with all my other panelists that the composition and exclusion criteria in the formation of a support group is extremely important and needs to be addressed before the formation of the support group, as it is going to impact the personality and social habits of the members. So what I would like to explain further is how it's going to impact the person who is within the group, because it's almost going to be like the support group is going to be like friends, normal people whom you connect with on a daily basis because you found something in common with them. And the same way how your friends are going to influence you on a daily basis, that is how you are going to get influenced from the people who are within the support groups as well, because you are going to connect to them and understand the problems with them, and you are going to try to incorporate what they suggest to improve yourself and your life further also. So this can work once again both ways, and based on the criterias addressed, it can include or exclude people. It can include people who were not meant to be in the support group, or exclude some people who were extremely important and vital for the group's improvement as a whole. So it is a very crucial topic to be discussed before, and it can influence the people within the group as much as normal friends do. And it can convert the bad or detrimental habits that the person have into good ones, and may even try to open up more avenues for the for the people within the group. Like they may based on the push of someone from the group, they can bother to try out new things and move forward and try something new that they've never done before also. So all of these things are going to definitely be dependent upon this composition and exclusion criteria of a support group, and it is something that needs to be discussed before the formation of a support group. And I think with that, I would like to conclude my answer for this question. Thank you.
Thank you, Monisha. I think the second question, it was like quite important for us, because I think many of the online support groups that have sprung up over the last 1 year, not everyone has a very defined exclusion or inclusion criteria. And we can't always generalize. We can't even call a group homogeneous all the time, because one person who's suffering from one mental disorder is not necessarily free of any other mental disorder. So it's a screening process that, as someone had mentioned, I think that is a very like something unspoken of before. I think that is a very insightful point. Right. So moving on to our next question, and that is something that's going to reflect your personal views on this whole discussion that we've had till now, is how likely are you to recommend group therapy to a friend who is coping with a mental illness or disorder? So Gul, we're going to start with you.
Right. So I think you kind of aptly summarized the question, where it will kind of show our own personal views on what we think about what about the whole topic in hand. So the first thing that I would like to say was that coming back to the first question and the discussion that we had, as mentioned by Shivani, that it is very important to recognize that if there's an acute illness going on which needs immediate help, which may not be within the scope of an online support group. Also, depending on what type of an illness it is, whether it is a very severe psychiatric illness which may not be handled well by the person who is able to provide that therapy. So I think these are the things which have to be which we have to be mindful of, and also everything has to be tailored regarding like Dr. Roop mentioned, that you have to tailor the therapy to what kind of needs and wants they want. We can't just put everybody into a single box saying, oh, this person can benefit from online support group, oh, this person will not, because again, every person will react differently. Every person has different triggers. Every person has different things which make them feel better. So it is very vital for people to assess and kind of come to that decision themselves. It is something which definitely can be tried, excluding a few like acute illnesses or very severe illnesses. For other people, it is something which you definitely try. But a few points that I would like for people to keep in mind when they're trying this, and this I would recommend to a friend who I feel like will fit in a criteria which can benefit from online therapy, would be to make sure that the person who is imparting the therapy, they have the proper qualifications and they have the proper experience. Because a lot of us, there has a lot of course, a lot of people, it comes from, I'm not going to say that they try and take advantage. A lot of people genuinely do want to help, but they may not be equipped to do what is needed, and it is up to them to recognize this. And also the person who is seeking therapy can keep a lookout and see what will benefit them, what kind of a person they want to talk to, what kind of qualifications they want. The second thing, which I don't think was mentioned during this topic, this discussion that we have, was security. A lot of online groups or any online activities are very, susceptible to hackers or people trying to take down their information, or even trying to take advantage of people in their vulnerable times. So support groups can be such a, right target for people who may want to take advantage or who may want to gather personal information about somebody. So it is very important to keep that in mind as well. Encryption, or just that the server that you have is safe, and just keep it. I mean, it is very difficult in times like these for our personal information not to be, available to hackers and other people, but just something that we can keep in mind. And the third would be just to kind of form your end goals about what you want to kind of gain from that therapy. This is for both people, the people who are imparting as well as the person who is seeking therapy. So they have to kind of sit together as well as independently come up with whatever end goal they have. And if like a friend of mine, I feel like could benefit from online support groups or needs therapy and is kind of either unable to go, like we mentioned, the stigma of going to in-person doctor or things like that, or just it's also online therapy is cheaper as compared to in-person therapy, which is also a very big setback for a lot of people, especially in the LGBTQI community, because a lot of these people experience homelessness or a lack of support from their family, which can also play an important role. And so it can help, online therapies can be more helpful to these people, since some form of therapy provided in a good way is better than no therapy at all.
Thank you, Gul. That was a very detailed and very insightful answer. Right, Shivani, you're up next.
Yes. So I would like to share this on this platform that during the pandemic, actually one of my friends, so that person came up to me and actually opened up to me about that. So the issues are there, like I can't really talk about it freely, but yes. So, and I, like that person was discussing it with me, should I go for online therapy or no? And we had a really detailed conversation about this. Like, okay, if you do tend to go for online therapy, have you shortlisted the therapies that are available, or the support group, or the person you would, the platform or the medium where you want to do this? So yes, I thought that that person really needed therapy, and I definitely recommended. I did my own research as well, and I helped that person out. So yes, in such difficult times, I think so it's really important that we should be aware with what our thoughts are and how to cope up with those thoughts and our inhibitions and our feelings. So definitely we should seek help if when required. It's really important to recognize, and also the question here, as it says, that would you recommend? So it's really important on our end as well to recognize, if I will bring up this topic of therapy with this person, will that person be able to understand what I'm actually telling, or will he or she will be like, offended, or how can you suggest a therapy for me? So like, that's really important to take into consideration, how your equation with your friend is and how your equation with anyone around you is, whether they'll be supportive of this suggestion or no. So yes, but yes, therapy, we should definitely highlight it more, promote it more, talk about it more, create awareness more. And Gul has mentioned a really important point, which is very much most likely to happen in India: the hacking and the forgery, the fraud. Like India is susceptible for this sort of things. So it's and when it comes to Indians, we are really protective about our information. We don't really even when with our neighbors or with our friends, we're like, "Arey, don't tell this person. Don't tell your family secrets and family stuff to your friends also." I am pretty sure all of you, even your parents would have told you at some point of time, don't discuss family matters with someone, a stranger. So yes, definitely. So we need to, when we are recommending therapy as well, we need to think about all these other factors. We should highlight therapy. Everyone should go for therapy, I feel. Yeah. Thank you.
Thank you, Shivani, for bringing up such relatable points for us. And one thing even that hit me is the thing about forgery and hackers that you and even Gul mentioned. That brings me back to the title of our discussion today, Flattening the Curve. Because over the last 1.5 years, ever since the pandemic started, there have been so many online therapy programs, mental health, random organizations coming up with so many initiatives, and we need some sort of regulation too. Before we recommend something to someone, we need to know if what they're going for is legit. And if we take up some initiative, we have to make sure that the people who are involved in implementing it, they are staying true, they are maintaining the confidentiality of those who are joining it and doing their work the right way. So regulation is something that is lacking currently and something that we need to pay more attention to. Right. So next up we have Dr. Roop. What's your take on it?
I am very, very likely to recommend therapy. I agree with Shivani. Most people should go for therapy and we should try to reduce the stigma around it. I believe that once it goes both ways. It is also the responsibility of the person seeking therapy and the moral responsibility of somebody who is claiming to provide therapy and counseling, that the provider or the facilitator must be qualified to do so. Right? They should be a professional who know what they're talking about. They should be able to provide effective ways of coping and counseling to the members who are seeking help. Now, coming to group therapy specifically, I will only recommend group therapy to a person who will thrive in a group setup. So a person, let's say there's an XYZ person who is suffers from anxiety, and one of their triggers is a group setting where they have to go and talk. So that person will obviously not thrive in a group. They would want one-on-one sessions or a smaller group to begin with. Right? So the person must thrive in a group setup. They must be able to work in a group setup and follow the instructions in the flow of the group that is done. Also, in group therapy, there is a single line of treatment that is followed. So there's 10 people, there is one facilitator. I will give one therapy, one way of therapy, one counseling session to everyone. So this comes back to the second question itself, that the screening and the importance of creating a homogeneous group. Because all 10 people must benefit from my single line of treatment that I'm providing to them. Right? It is not, group therapy tends not to be person specific. It is group specific. Right? And group therapies will only be effective if the people who are engaging, the members, are ready to have open conversations. They are ready to come forth, break out of that shell and have actual discussions which will aid in their recovery. Right? Also, patients must be, so the members who come, they must be made aware that this is a safe space and we must maintain confidentiality, which is something that I feel Indians struggle with. Right? It is very important. It has to be a safe space. You have to have confidentiality in the group. Along with this, patients must be made aware that, let's say, the group is being run by one person. So the people of that group must be made aware of the time limitation, that I am, as the facilitator, will only be accessible to you 1 hour a day or 2 hours in a day or only via WhatsApp. So this excludes all the people who will need emergent care. Anybody, we come to the same thing, anybody who's actively suicidal, severely depressed, in an acute crisis will not benefit from group therapy because that person will not be accessible 24/7. Lastly, group therapy must be a cohesive unit and there must be room for interdependency and good interpersonal skills. The members must feel safe and must empower one another in order to succeed and recover. And it is only then that they will be able to come out of their illness or accept it or make it a part of their life, let alone be defined by their illness. So it is very tricky, and we must choose the kind of therapy that we are recommending as medical professionals, as doctors, to our friends and our family. We must do a thorough workup with them, what kind of environment would be best suited for them.
Absolutely. Thank you, Dr. Ru. Those were some very insightful points that you brought up. Before recommending something to someone, we must first be sure that we know what exactly they need, what they're looking for, and then go forward with any kind of suggestions. Right. So, Dr. Molly.
Hi, thank you so much. So to be very honest, in terms of recommending group therapy, the first thing which, as very rightly mentioned by Shivani, Gul, Dr. Roop, is to assess of how much is the need for that person to, to go for the group therapy, and if there is a chance for that particular friend or that particular person to feel overwhelmed by a group therapy, because we know that sometimes group therapies can be a little overwhelming with so many people with you together, so many different opinions and ideas on the table. So if I personally feel, and if I know that person well, that this might prove overwhelming, I wouldn't recommend group therapy. But if there is a chance, or if there is even a slight chance of getting more perspective, not just, let's say, I mean, the first goal would be that this group therapy helps that person in the most impactful way. But even if I feel that there is a chance of that particular person getting a better perspective or getting a different perspective, I think group therapy can be mentioned based on the severity of the situation. Again, because an already severe situation wouldn't want to be overwhelmed in any way. And again, I feel that at the end of the day, when we're recommending anything to anyone, let's say group therapy in this case, it's important to let that person know that this is your space, this is your safe space, and it's okay to discontinue with it if you don't feel comfortable. Because many times, when we're recommending something, there would be people who feel obliged that, okay, this is something which this person has recommended, let's give it a try. And they sometimes, I mean, not everybody, again, I'm not speaking for everybody, and it depends from case to case basis, but there would be some people who would just keep continuing it in spite of that not helping them, or that putting them in a deeper hole where they're trying to get, when they're trying to get out of it. So it's important to let that person know that, okay, it's like, go ahead, try this out. And just to let them know that this is a group therapy, there will be different people putting in opinions, there wouldn't be a single person talking one on one with you. Just letting them know of what the scenario is, so that they are mentally prepared when they go forth with their inputs or their ideas. And again, at the end of the day, it's important to make them feel that this is a confidential space. So at any point of time, if they feel that is being violated, it's completely okay to leave that group. So I feel that it can be recommended based on one, like just to summarize what I said, to be, based on the severity of that person's situation. And also, if you're recommending, to let them know of each and every possible scenario which they might come across, so that they are mentally prepared, and they don't feel overwhelmed at any point with new or unique experiences which can be uncomfortable to some people. So that's about it. Thank you.
Thank you, Dr. Molly. I think something very important that you mentioned is when we recommend any form of therapy to someone, they must know that they're not obligated to continue with it if they're not getting any benefits from it. And of course, therapy, the perfect psychiatrist is not that easy to find. Like I have friends who have tried 2-3 psychiatrists, they have felt dejected, they felt that it's a waste of time, and then they completely stop believing in the concept of therapy. And then again, maybe after 2 or 3 more tries, they found someone who actually helped them, and they actually turned out quite life-changing for them. So that is something, it's not that easy to find a perfect solution to any kind of mental health disorder, right? So Monisha.
Yeah, so for this question, once again, I would like to completely agree with all the panelists who have spoken about this before, that it is a completely person-based situation, and I will definitely recommend online group therapy to my friends and family, but it is going to be based on the person involved who is feeling low and is facing the mental illness. So some people will want to feel connected, and they don't want to feel alone in their quest towards improvisation when they don't even understand the disease properly. So for these kind of people, I think having a group support therapy will help, because they can sit together, analyze the disease together, connect with each other, and understand what has worked or hasn't worked for the other person, and why it has or hasn't worked for the other person, so that solutions can come out together in terms of the group. In terms of the entire group, you can figure out what works and what doesn't work, and analyze why it didn't work, and try to make sure it works for the next time. And that sort of a discussion can happen more openly in the group. But once again, it has its own disadvantages in terms of security, like Gul mentioned, and the right kind of group, and how it all works out in the end, and that sort of a thing. And hence, the people getting the recommendation should also be warned of the chances where it may or may not work. I think that is really important, because they can trust your recommendation and go and sit for the group therapy session, and in the end it may or may not work. And when it doesn't work, there's a possibility that like Molly mentioned, it can push them deeper into the hole. So they need to be made aware of the fact that this is just one kind of a solution to the mental illness that they have, and there are numerous other solutions and other ways in which it can work, and the possibilities are endless. So if this doesn't work, it's all right. So that is something that needs to be stressed upon, so that they don't get overly involved in it only to come out dejected. So like I already mentioned before, mentally ill people have greater chances of feeling more vulnerable and feeling more how do I put it, feeling more hopeless in their understanding. So this needs to be made clear to them in prior, as and when you're recommending it to, but they should definitely try it out if this is something that they can get help out of. So yeah, that would be my conclusion for this question. Thank you.
Thank you, Monisha. I think you really beautifully summarized the whole last question that we all were discussing, that there is no one right solution to any kind of mental health problem. Like there are many options that we can take and see and try. It's like a trial and error process. We have to see what works for us, right? So, so as we come to the end of today's discussion, there's one last thing I would like to ask all our panelists. And this is something that would perhaps fulfill the sole intent of today's discussion is, so what are your key takeaways for you as well as your organization from today's session? Gul, we'll start with you.
I think key takeaways would be, like you mentioned, that therapy is something which is so person specific, and everybody has to be aware of what works for them, what doesn't work for them, and also that it is so important to provide people anybody who is in search for therapy is either A, seeking some answers, B, seeking validation or acceptance, or trying to come up with something which will help them cope up in their normal life. So it is very important to provide them with tools which they should know before going and seeking therapy in any form, whether online or in person. They have to be aware of what kind of a person they need to talk to, what kind of a therapy it should be, in group therapy or in person therapy. If it is in online, like we mentioned, the kind of security that they're providing, the credentials of the person, what sort of goals and end goals they have from that. So it is very important to keep these things in mind and then finally come up with what works for you.
Thank you, Gul. What about you, Shivani?
Firstly, I would like to thank everyone and thank you, Dr. Sparakos, for yet another successful and such an interesting topic, to come up with such a topic. Because today I've learned a lot. I've learned a lot from everyone, and specifically from Dr. Ru. Before starting or before creating platforms and organizations, the organization itself has to do a lot of homework, a lot of research, and then provide the help and the services. So she had beautifully summarized it in her answers, and I would definitely, that would be a major takeaway, point which Clinic would love to work on. And I would really, if you guys don't mind, I would like to use this opportunity to sort of unofficial and officially announce that Clinic is actually working on a project, a platform in Clinicase itself to provide such online support group, not online as well as offline, for cancer patients, because not many people are aware about it, but my mother herself, she is a cervical cancer patient, and since 2 years we've been it's a long journey. We've been fighting it and overcoming it slowly, and I and my family have come to such a huge realization that there are so many people in India, so many people in Mumbai itself who are suffering from this disease, and it's so difficult for their family and for them to come to terms and accept this diagnosis, because cancer is not just a one-time diagnosis. Okay, it's a fever, you take medicine and you're done with it. It's a long journey, and I have been a part of that journey. My family has been a part of that journey. And we are providing all sorts of help that our mother, my mother, requires. And I learned so much, and I realized so many stuff that this is what our community needs. So we are working on something. I can't really disclose everything, but yes, please look out for it and do support us. That I would definitely implement what all Dr. Rup has mentioned, and Dr. Molly and Gul and Monisha. Thank you so much. So definitely, yes. So this will be the key takeaway for him. Thanks.
Thank you so much, Shivani. That's a very inspirational story, and Clinicase has a surprise for us. Really looking forward to that. Right. So, Dr. Roop.
The last thing that I would like to stress on would be a need for us to influence or to increase the pressure on the government to set up more helplines, more therapy groups, have more therapists psychologists in a hospital setting, right from a tertiary care center to a rural healthcare center. It is important for everyone, each strata of society, every single person to have access to therapists, facilitators, a group, a safe space as and when they need it. We have so many different issues. We have farmer suicides. We have women who are suffering from abusive and domestic abuse and dowry deaths and so on and so forth. It is very important to place a lot of pressure with the upcoming election on the government, because if COVID has taught us anything, it is the importance of mental health. We have been confined to our homes for nearly a year and a half now, right? So this, if we do not learn from this time to place an importance on mental health, I don't think we'll ever learn. So this is one thing that I would definitely like to stress on all of us, as we come from various student organizations and are in a position where we can put forth these issues. So I feel that we must use this to our advantage and help other people who might not be in such a privileged position. Other than this, I believe that therapy is person, situation specific. It depends on what kind of needs I have, what will I need as a person, what am I going through, the stage of my disease, the kind of personality that I have, the kind of group that I will thrive in, all of this. And obviously it does come with a sort of hit and trial. You do need to go to, it can be that you do need to go to more than one group, more than one psychologist, more than one psychiatrist. And it is important not to lose heart and not to, put your hands up and say, this is it. You must fight for your mental health, as only if you're happy in your own head can you thrive in your life. I'd also like to say thank you to all the organizers of Doctors for a Cause. It has been a very interesting discussion, and all the participants from Gul, Shivani, Monisha, and Dr. Molly. It has been an absolute pleasure to interact with all of you and listen to such different thought processes and the kind of points that you put forward. It was truly an amazing session. Thank you.
Thank you, Dr. Roop. And I think we all have learned a lot from this discussion and have learned to look at mental health and therapy from many different perspectives, because we all had this preformed idea of what therapy might be like and what it might feel like to a person. But like listening to all of you put forward so many points that I've never considered before, it really made me think. So yeah, so Dr. Molly.
Hi, thank you so much. Firstly, this has been a very, very fruitful discussion, and listening to everybody's thoughts just, it was very engaging, to listen to each and every panelist and to bring new ideas to the table, to bring new perspectives. To be very honest, when I was thinking about the first question, the point about severity of, the severity of the depression of a person did not come to my mind in the first place. But when I heard it, I was like, oh right, this is a new point and this is a new perspective to look at. So just giving an example, but that has been the tempo throughout the panel. And thank you so much to Doctors for a Cause for organizing it on such an engaging topic, and to all the panelists here. I think two major takeaways for me is, one, I like to revisit the question that the curve shouldn't flatten, because the curve with respect to online support groups, which are one way of therapy, which are one way of people accessing help or seeking help, and and growing themselves. Because as I mentioned in the first place, just seeking help is a way to grow and is commendable, and hats off to everybody who identifies and who is willing to seek help and build on themselves and work on themselves. So that in the first place is commendable. And I feel that that curve on conversations around therapy, on let that be online based support groups or let that be through in-person therapy sessions, shouldn't flatten. And secondly, I feel that from all our discussions and all of us have resonated on the fact that ultimately it is extremely important for a person to find their safe space. And I very proudly can say that MSI has constantly been advocating on, on helping students find their safe space. Let that be in any discussions, let that be on let that be on public health, or on SRHR, on or on anything at all, or even on on depression or mental health, like anything at all. But the ultimate goal for, I think, all student organizations at this point is to help medical students find their safe space, because only then they'll grow. So that was a major takeaway from for me. And thank you so much again. Over to you, Shreya.
Thank you, Dr. Molly. Manisha, we move on to you.
Yeah. So my conclusion that I derived from today's session was that support groups are definitely a great way to, help people in distress, and it can play a really crucial role for a lot of people. But at the same time, it is something like, something that has two sides to a coin, and comes with its own advantages and disadvantages, and that we need to do a lot more in-depth research and understanding about this, and make sure that we know completely about it. And at the same time, the advantages and disadvantages should not stop us from spreading the message about it to the entire country. Because as public health activists, as well as active mental health advocates, we have a responsibility to work towards the understanding and awareness of all the kinds of solutions to mental health and mental illnesses, and make sure the people understand and acknowledge all these different kinds of solutions, and reach out to what they resonate with more and what they think will help them more. So yeah, that would be my conclusion. And I would like to thank Doctors for a Cause, Shreya, yourself, and all the other panelists here for such an amazing, fun discussion about something very important. I learned so much from this discussion, like how Molly mentioned. The entire tempo of the discussion was, oh my God, I didn't think of it from this angle, was how it felt every single time. So I would like to conclude with, let's have more discussions like this and break the stigma towards mental health, and make sure our country becomes more open and becomes more acknowledging towards mental health and mental illnesses. Thank you very much.
Thank you, Monisha. That was very well said. And I think one reason why we all get so excited at the mention of, family problems, stigma, is that mental health is something that these struggles are something we relate to it so much, and still people around us talk so little about it. And this reminds me of something that someone from our first RT had said, and that was, who does not need therapy? Like, honestly, we are always thinking about who needs therapy, what kind of therapy do we give to this person, but like at some point or the other, who does not need therapy? If we can go to a doctor, if we can go to a cardiologist, if we feel like a breathlessness, and like why can't we seek some mental help when we feel down, when we feel like we feel feel difficulty in waking up in the morning for 2 days straight, like something is wrong, but we don't always have the courage to face it, to talk to anyone about it. So as Dr. Molly had said, that acknowledging that we are struggling with something and seeking help itself is something to be proud of, and something that we should encourage more people to do. So thank you, all of you. I feel really grateful to have interacted with you on this very important, very exciting and relevant topic. And right, so with that, we come to the end of this discussion. I would like to thank you all for joining us today. A very big thank you for Avik and for Yash for helping me conduct this session. And please switch on all of your cameras. We can have a picture. Yash, are we ready for the picture?
Yeah, sure.
Okay. Smile, please, everyone.
We do one like done, guys.
Okay. Thank you all. I think we can disperse for today. It was great interacting with all of you. Bye-bye.